Hello, everybody. Welcome back to another episode of Eat and Talk. Today, I'm joined by my sister Munira, and you guys, we're gonna have a really interesting episode and topic today. You guys know I love health. If you've seen some of the community work that I have done, it's always about advocacy, and a big part of that is health advocacy. And I'm really excited because Munira is an expert, someone who is a phenomenal nurse practitioner in our community. And she is going to educate us today and also kind of, give us a lot of insights and things that we need to know and things that we don't talk about in our community. When I say our community, I'm talking about woman of color, Black woman, East African woman, woman that look like us, Indigenous woman. So let's get into it. Monita, thank you for joining me.
Well, thank you for having me. I'm so excited to be here.
I am so excited. We have been planning this for a while, so I'm glad that we were finally able to make it happen. I want to start off kind of like tell us a little bit about yourself. And I know I introduced, you as your title, but tell us a little bit more about what you do.
I am a family nurse practitioner. I work for a large organization right now, and I also do a lot of health equity work in that organization for two hospitals. And then I also partner up with other organizations who are trying to improve the healthcare system because most of it it's not built for a girl that looks like you or myself. So how do we change that is something that I've been doing for the last 7 years. I started with being a direct care nurse first, as a nursing assistant and then a nurse. And I was like, okay, I saw a lot of inequities and how do we change that? So I went into leadership and have been doing that for 7 years. And now I'm ready to venture out and create my own stuff for my community with my community.
That's so amazing. And I love that. And we're going to kind of get into that soon, a little bit later in the episode, some of like your own ventures and how you got into it. But I kind of want to talk about why is this topic important? And you mentioned how, um, receiving health services is tough for people that look like you and me. Tell me a little bit about how you've came across that and why we need to talk about this.
Yeah, absolutely. I think I would say the first time that I've ever personally experienced someone being racist towards me was in the hospital. It was me going to take care of someone, going into that room, and him not wanting me to touch him because I was going to dirty him up or something was going to happen. He's like, she's not touching me. So I went out and I'm just like trying to figure this out. Why is this happening, right? The nurse comes in, another nurse, and then says, hey, what's going on? Munira's your nurse today. When the whole thing. And then he just goes, I don't want anyone of color, let alone a Muslim, touching me, right?
Wow.
But instead of her coming back and talking to me, do you still want this patient? Because that was my patient. I wasn't going to give him up because I'm like, I can change his mind.
Yeah.
Give me the time, right? Or even like be a good bystander. How do you show up for your coworker who is being mistreated rather than taking that person's side? I felt so hurt by it. And once the shift finished, because I'm not someone who reacts to things in the moment, I waited. And then afterwards, I was like, hey, can we have a talk? And then she's like, oh, patients are always right. Even though I didn't like how he treated you, but we're just going to make sure that he gets people that he's comfortable with.
Wow.
Whoa, that was not okay
Yeah.
for me. And then that's when I knew for sure something had to be changed. And the next day, actually, at 7 a.m. in the morning, I sent an email to the president of the hospital. And I was
As
like,
you should.
this happened, and this was the outcome, right? I didn't feel heard. I didn't feel seen. I did not matter in that moment. And to me, I would never work at a place that didn't value me or value people that looked like me. And they took that seriously. And ever since, I've stayed in the same organization, and which has been amazing.
Good. And so in that same, and so like, what was their response? Like, how were they able to fix it?
Basically, there was a system in place that was never something that they've ever addressed from a higher level. It was always like different units, different unit managers taking care of it how they felt, like however that they thought they should take care of it, right? Which it wasn't after George Floyd era. It was where we didn't talk. People were saying, I don't see color, which I'm here, right? So we
Exactly.
had to change a lot of things and changing the system and having policies for all units to follow takes time. And so we created a committee, and from that committee now we've changed a lot of things. And what protocols do we follow? Even giving a person a flag, right? A aggression flag. Before the nurse felt like this person is mad or talks with their hands or says the B word, they tend to get that. And that's like putting someone a felony on their record because it follows them in the clinic, it follows them in any hospital that they go to, and we never know how does that come up.
Right.
And I was like, oh, can we get the numbers for how often people get this? Because now I know. By being in that committee, I was able to get those numbers, and disproportionately, it was men who were Black, who were younger, and who just had questions about their care or came in to see their dad or mom who were really sick, and now they've got that flag with them.
Wow.
And that means that people are not sitting down with them to teach them about their health information because they're worried about making him mad or her mad, right? What would happen is when they get discharged and they went to the clinic for follow up, the doctor is not spending that much time with them because they're a problem child now, right? And they tend to come back into the hospital more because they're sicker and sicker. So because we're not giving them all of the information that they needed. And nurses will tell you, oh, that person has a behavior issue. They are flagged. So all of those things needed to change. From that first incident, we were able to change all of, not just the dad, but a lot of other policies.
Yeah. And that's so terrifying, truly, because you're coming somewhere to address a health issue. It's already frustrating. It's already vulnerable moment. It's already there's just so many questions.
Yeah.
And so to come somewhere to get answers and also to come somewhere to get better, but you get treated the opposite, which I admire that you used your voice to bring awareness and not only bring awareness, but hold them accountable, like a whole institution. And then like join the committee and it was like, okay, this is the things that need to be changed.
Right.
But I can only imagine of all of the other organizations and institutions that don't do that or aren't doing that and how
Right.
many people are like falling through the system
Scary.
or being flagged.
Scary.
That is frightening. And I know there's been a lot of like statistics and I wanted to talk about also, for example, when it comes to like maternal health.
Oh, yeah.
Is it true that Black women are kind of undermined when it comes to their maternal health or just
Oh,
health
yeah.
in general when they arrive at the hospital?
Oh, yeah. Honestly, this happens every day, right? We tend to have low hemoglobin. So when a woman comes in and she's like, I'm tired, I'm fatigued, I'm all of this, we're not going, okay, let's look at her hemoglobin. Even if it's a 10, we're not giving her infusions. We're not telling her all the foods that she needs to eat because we assume that this is her baseline, right? Her baseline should not be deficient either. What can we do to help her? And in case she has a hemorrhage, if it was already low, her chances of having a complication is higher, right? Black women are 3 times more likely to die from pregnancy related complications. They are 40%. I think I was actually looking at this. 80% likely to get fibroids by the age 50. They are more likely to die from breast cancer than anyone else. They're more likely to have high blood pressure and not have the resources to actually stay in the hospital. And I've seen this happen often, right? So a mom will come in, she's pregnant, comes through the emergency room, and her blood pressure is high. So we send her up to OB. And once she gets up to the OB, she has to stay there for a couple of days while she started her new medication. But she has 3 to 4 kids at home. The doctor doesn't ask her why she's rushing to go home. All of a sudden, she's labeled, this mom is difficult.
She's like being erratic or something.
Yeah, she's not compliant. Do we need to call psych, right? Or this bundles me. A good friend of mine, he's an OB, calls me and he goes, Munira, I can't take it. You guys always talk about the statistics of moms dying and da da da. Why did they not listen? I was like, who is that? Who are they? Right? Because this my friend's talking like this.
Yeah.
What's going on? He knows who I am.
Yeah.
What is he talking about, right? But then he goes, yeah, I mean, you always talk about the stats, but they never listen. was like, okay, tell me more. So I ended up, and for me, I get calls when there's a difficult patient in the hospital or at a healthcare organization. I'm consulted to come and troubleshoot and stuff, right? So I went in. This is at 2 a.m. in the morning, mind you. I went in and I just talked to her, and she goes, hey, I have 3 kids at home. My mom has work tomorrow. I need to go home to be with my kids. You know what we could have done? Simply by asking her, I was like, let's get her a blood pressure cuff. Let's give her medication. Let's do one more monitoring. And then if we have a
Some
normal
resources
number,
and checking on
and
her.
let's check in on her in the morning. We'll have a nurse check in on her a couple of times a night if we needed to, every 4 hours. And she could check her own blood pressure. She's fine. But because no one asked her why she was going home, they were ready to just say, oh, we need to sign this off.
Yeah.
So if, in case anything happens, if your insurance will not cover you when you come back in, right? This mom can't afford that. So just like that burden that we're putting on them, just simply by not communicating with moms that look like you and I, and it's hard. So you know what happens then? That mom comes back in to have that baby, right? Now she's shut down. She's not going to talk about her pain.
She doesn't trust
She doesn't
anyone.
trust them.
Absolutely.
Yeah. So that's why complications are happening. It's because we're not creating that safe space to
And
feel.
that creates even more stress, and it doesn't create a healthy final weeks of the trimester for her and the baby.
Right.
That is just so disappointing. And I don't know how you deal with that. I would go crazy. Oh my goodness. And I'm sure, like, is there, it's always, this has been happening for years, decades, since time, right? But specifically this year, especially with the political climate, has it gotten worse? And especially with all of these resources being cut down and everything that's happening.
It scares me.
Yeah.
Because right now we're not noticing it as much. I know that hospitals or clinics, we are having to see more patients. Like for me, for instance, right? Instead of seeing 15 to 16 patients a day, I would have to see 22 patients a day, right? Now that takes my time with every patient will be 20-minute visits rather than having 30-minute visits, because organizations are not getting most of the funding, so they have to make that up somewhere, or not having the flexibility to take some days off for even providers for their own mental health and not having to work so much, right? But it really worries me that we're not going to do all the outreach that we're doing, all of that health literacy improvement that we were doing. And then even vaccines, right? CDC is now rechecking things that were already set on. So there's a lot that makes me worry. That makes me worry for small organizations, small clinics that are actually doing the work.
The local community work.
Right.
Absolutely.
Right. And for the reason why a lot of people of color are not getting the care that they need is lack of access, right? So community clinics that are going to shut down, now we're not going to have as an access to care for a lot of these people. People are going to be sicker. People are going to end up in the hospital more, needing to stay longer.
Even with like pharmacies, all these local community pharmacies, it's very convenient for those who don't have, transportation and cars to walk across the street or take a bus to their local community pharmacy because they can't afford or go to Walgreens or Target clinics and those type of things. That is so scary. So what advice do you have for patients? What can they do in these tough times?
I think ask questions, ask for help still. Even if you're noticing that you're not getting the extra care that you are getting, go to community clinics and say, hey, this is what I'm told. Ask someone that you trust and say, hey, read the AVS with me. Or if you felt like your interpreter missed something, because I get this a lot. I have patients who will use an interpreter in the clinic, and I'm like, I don't think it made sense, because sometimes you can understand things, you just can't speak it, right? And they're like, hey, can you explain this to me? And then I find out, this was off, right? And we're starting to do more education for interpreters to ask, even like for themselves, to say, can you explain this to me, to the provider, so that they're not giving the wrong information. I recently had a patient actually come in, and I was doing her pre-op before she has her surgery the next day. okay?
Mhm.
And she's supposed to have a whole hysterectomy. She's 34, Somali speaking, newly immigrant. And I was like, why is she getting this? We have other options in my head, right?
Yeah.
And so I go through the preventative and I look at her history. And then I ask, I was like, do you have any kids? And she said, like, no, but I'm getting a lot. My period is just a lot. Every other week I have period. Like, you know what I mean? And then I was like, oh, okay. Do you know what kind of procedure you're having? Because I'm like, dang, dang. She just got married, the whole thing. So she's like, yeah, I was told that they're gonna go in and just take a look and see why I'm bleeding, right? I was like, no, that's not what we're doing.
Yeah.
So I call and then I was like, okay, give me 1 second. Because I wanted to go check and see if she used an interpreter and called the surgeon. And I said, hey, I have a patient that you're gonna see tomorrow at 8 a.m. to do a procedure. And she doesn't understand what kind of procedure she is getting done. Did you see her by herself or did you have an interpreter? And apparently the interpreter didn't understand what was being done. So she explained it as someone who's going to have
Like a
pap smear.
biopsy?
Like
Oh,
a
pap
pap
smear.
smear.
Okay.
I was like, no, that's not what it is. So we ended up canceling that appointment. This young lady, I swear, it breaks my heart. She started crying because she's like, "Allah, right?
That's
Like
so
meaning that,
dangerous.
yeah,
Yeah.
she's like, right? Because a
Exactly.
lot of us, we identify having kids and all of that as what makes you a woman, right?
Yeah.
And just how terrifying.
Very
So that was another
heartbreaking.
project that I had to like say,
Oh
hey, we
my
need to train our
God.
interpreters.
Okay, so that's like a whole other thing because whose responsibility is to train
Ah,
the interpreters?
good job. That's a good question, honestly. For hospitals, they do not they have to be licensed to, but they do not have to be specialized,
Okay.
right? So meaning that for specialty, I could say, hey, I want to get paid a little bit more, then I get a specialty certificate. But otherwise, they only have to have the basic testing done, meaning like basic medical um being able to say things from Somali to English or Amharic to English, that kind of stuff, right? It's not you have to know the whole thing, or they can possibly know. But what I have been pushing for now, ever since that day, and it's not just me, because it has happened to other providers,
Yeah.
same situations, similar situations, and now we're all coming together and say, hey, can we do the training for them? I've got a Hmong MD who's working with me on this project now. I've got another Vietnamese, because they all had the same experiences that happened to someone that speaks their language. So that we're all invested in coming up with something that's going to work,
Yeah.
because it matters.
It
Your life
matters so much. I
Yeah.
mean, you're communicating very
Exactly.
vital information to someone's life. And it's like anything that isn't, effectively communicated, like that's scary.
One thing, right? Yeah.
Oh my goodness. And that like leads me to ask, like, with technology these days,
Yeah.
and honestly, even with education, because I'd be a little bit wary. And I'm like, these new students
What
are
is
gonna be
going
my
on?
doctors, and they're over here like,
ChatGPT.
I'm scared. I am more scared. But do you think that there's pros and cons, or what is the direct correlation with this? I mean, also there's technology enhances health services. So tell me a little bit about how that comes into this new world of health and technology.
So I teach a doctorate level classes at Metro State.
Yeah.
And I can see the writing has changed. You're like, I can tell what was not written by that person, right? I was
Oh,
like,
Lord.
So now we've got ways to vet that stuff. And I sometimes I'll put the first time in and it's like 70%.
Yeah.
It'll pick it up. And then having those conversation has increased from the beginning, even like last year compared to right now. I feel like I'm having more of those discussions to say, I need you to write this.
Yeah.
I mean, you can get ideas, but most of us can tell that kind of
Yeah.
stuff. I think we're becoming a little bit more lazy to like have ChatGPT help you. But when it comes to medicine, honestly, I think it has helped with a lot of notes that we were writing, so we can spend more time with patients and teach and all of that stuff, so that you're not behind the desk and just writing
Having to write
notes.
all the notes.
Yeah.
It's being recorded for you.
Oh, yeah.
Mhm.
Now that has been so helpful.
Yeah.
I can see how that will make more time for clinicians to spend with their patients.
Yeah.
I hate when I go to the clinic and I'm doing my physical and the doctor's like not looking at me. I'm like, I'm over here,
Yeah.
you know? So
Absolutely.
that's my biggest pet peeve. I try to be present and
Yeah.
listen and you to feel like your time matters. So
Absolutely. Well, thank you. That's a good answer. So, speaking of clinics, I would love to talk about your clinic, which is called Inspire Change,
yeah,
right?
Inspire Change Clinic.
Tell
Yeah.
me about Inspire Change Clinic, why it was born, and what services you provide.
I love this clinic. So for the past 15 months, what we did were we did community education from workforce where we brought 24, we were supposed to take 15 students, but their essays and their dedication was so good that we took extra and we ended up paying out of our own pocket to take care of those students and train them and get them in the healthcare field. Now they're working as an x-ray techs, they
Wow.
are working as CNAs, phlebotomists, all of that stuff, right? And it just brings me so much joy.
Yeah.
I
And you
knew
guys train these
we
students.
train them,
Okay.
we get them certifications, we have partnerships with colleges, hospitals, and all of that stuff. And we brought HR to them and just rather than all, we removed all the barriers that they would have gone through, the barriers that I went through. There's so many other doctors that have volunteered to just their Saturdays so that they can teach these students also, so that they can have that real life experience, hands-on experience before getting into the hospital. Because I would hate for anyone to experience racism the first time in the hospital going,
I
what
know.
is going on?
And just like chase you away from your goals and
From your
dreams.
yeah, we don't want that. So we wanted to give them, we did simulations showing what could happen. We
That's
did
so amazing
yeah.
that you can like prepare for them before they're thrown into the
I
real
Oh
world.
my God, yes. I think a lot of headaches
Yeah.
are saved for them. I feel like they're lucky to actually go in now. They're prepared, they've got the tools, and they can teach others too because they plan on coming back. Another thing that we did was the motherhood circle. We wanted to give, because a lot of moms, like we talked about
Yes.
all the things that
Let's
they
talk
go
about
through.
Motherhood Circle.
Yes.
What is Motherhood Circle?
Love this. I wish I had this. I had my daughter when I was 18 and I had no idea. All the things were just happening to me,
Yeah.
right? I didn't even understand why vitamins were important.
Yeah.
I remember I loved just like milk, red milk, and I was like, why am I gaining weight?
Yeah.
Now I know, right?
Yeah.
So understanding that was really so like now we focus on nutrition, we focus on self-advocacy when you go in to see your provider once a month or once every 2 weeks. What do you tell them? What are some things to like say, hey, I'm noticing this? Or how do you bring conversations that you may be uncomfortable with? So we give them all those tools. We talk about blood pressure. What is a normal blood pressure? We talk about thyroid. We talk about any vaccines, all of that stuff. The reason why we do that is we want to create an environment where they feel comfortable and they are not a guest anymore because we bring guests from the hospitals. And then we have these medical directors coming out to teach a topic that they like to our community members. The community members now feel like that doctor that's coming to teach them is the guest, right? So now they can ask the questions. They can make that person feel comfortable, but now they have the higher what is it called? The power or whatever you call it, the upper hand now, right? And then we ask those providers that are coming in, go back to your hospital, your clinic, and make sure that you listen to the pain that our community is going through and make one change. And then we ask them to follow up with us 6 months, 3 months down the line and let us know what they did. Because that is, I don't want you to come to my community, get all the input and not make anything and do nothing with it and not even tell them what, or even if you did something. And I was guilty of this in the beginning too, right? Coming to the community, getting whatever feedback that we could get from them, but not coming back and telling them, hey, this is what I did with it, right?
Here's the output. Outcomes.
Because then you're empowered to say, hey, my words matter. And something came out of it. That right? And I love the idea of I helped you. Now, you actually, whatever that you told me, this is the changes that we made with. If you go to this hospital, you'll see this change because of you. This was you.
Yeah.
And recently we did something on mental health because May was a mental health awareness month, and we did postpartum depression. We had 52 moms from the community there. And they talked about how they do not fill out a sheet called the PHQ-9. It's a form every year when you go in for your physical, everyone fills out. Honestly, 90% of my patients at Minneapolis will fill out, will say 0. And I didn't understand it. So one of the questions that I asked was, how do you feel comfortable? Like, how do you feel about these questions, right? Everyone just kind of shuts down and says, oh. And then I find out that they didn't understand what that was.
Yeah.
2, they thought that they were getting a record and have something like stigma or something that
Right.
we're going to look at them sideways. Now they
Yeah.
have to take
'Cause of the
medications.
ebb and whatever.
Yeah,
Yeah.
but then I was like, no, this will give you resources. We're not going to take your child away, because one of the moms says, "Habeenkii markaa seexdo," like at nighttime, because she wasn't getting a lot of sleep. She didn't want to ask. Her husband was a truck driver. She doesn't have any family members close by, and she was so tired. And I think low hemoglobin, everything else, right? Low vitamin D. She would have nightmares where she was hurting her kid. So she would like watch him just cry. She goes, I would freeze. She's like, meaning like I froze in place and I would just watch my child cry. She's like, I didn't want it, but I would watch him.
Yeah.
But that's a sign, right?
Yeah.
And that's something that I want you to talk about.
Yeah.
So,
Help you.
let us get you help. This is a resource that you can get. We can help you mobilize your own community to help you also. And just once we talked about that, I went back into the clinic. My first patient that I saw, I was like, okay, I'm going to go in and I'm going to explain this PHQ-9 and let me see if I get a different number. I didn't think I would. This patient has been coming there. He's new to me, but has been coming to that clinic for years. Always has been 000. This is a Somali man in his 40s, right? And I felt like something was off. And so I was like, hey, this is the sheet that I want us to fill out together. Maybe the words may not, like something may sound funny to you, but let's just go through it, right? But I told him, anything that we talk about, I promise you, unless you tell me that you're going to kill yourself or kill someone, I'm here as a resource. And then I find out that he was struggling and getting him on meds. And then now he follows back up with me since May. I've seen him once. And it just makes me proud that he just needed someone to explain to him what it was and what I would provide, how I was going to follow up myself. I was like, no one else, meaning that I would call you. No one else is going to call you. So I eliminated that part. I can do a reminder.
You're building that trust.
You know, I'm here for you. So I thought, okay, so follow-up came 6 weeks later. I was like, he's probably not going to show up. I swear to God, this patient was early. 15 minutes.
Wow.
We just bonded.
Yeah.
So I wanted to I didn't want to open a clinic right away without listening to the community. This clinic honestly was made for the community, by the community, their input, what they wanted to learn. And it's not a clinic that's going to we're going to see everything, right? So preventative, we're going to do a specialized care, everything from 0 to 100. But we're only going to take 100 patients for the first year. And the reason why we want to cap it at that is because we want to make sure what happens when you get a care that's tailored to you, a doctor or diabetes educator, a nutritionist, all of that stuff that know you by your first name, that you can actually call on the phone and they'll go over whatever questions that you have themselves. They'll call you when you didn't pick up your medications or you want to talk about it, right? Or even go on walks with you. What happens? Can we impact your family better? Because I do a lot of research work. We've had several articles written, and the way care is done right now does not take care of someone that looks like me or communities of color, period, right? So we need to change something. And in order to change that, we have to understand. And I want to do this 100 patients and see where we go with them.
Wow. That's amazing. So, I'm just like positively overwhelmed with that information and all the things that you do for Inspire Change, especially for our hoyoin and our our mothers, even our Somali men. That's like, because even me, someone who grew up here,
Yeah.
this medical jargon, like I don't be
Man.
understanding, and I
Right.
also be a little bit terrified as well, because I'm like, how honest can I be? Are they going to because I've had some experiences
Experience.
where I'm
Yeah.
like, I can't. So that leads me to ask you, within our Somali community,
Yeah.
what are the most I guess like health problems,
Mm.
most common health problems, health diseases that you come across?
If I can talk about this, I would say we don't do a lot of preventative visits. We do not do screenings, right? Whether it's your mammograms. If we need to understand the importance of getting your yearly mammograms, why it is important to get colonoscopies, right? Because it's the number one killer for Black man. Cancer, like number one killer, right, is colorectal cancer, and we can prevent a lot of that, right? And that is just you could either get a little kit, put your stool in it, prepaid envelope, and send it in, right? That is good for 1 year. Or you could do a colonoscopy that could be good for 10 years, 5 years, 3 years, depending on whatever that they find. That is, we need to do more preventative visits, and not just the visits, but like we give you a referral and get those done. Because I see too many times, I see 42-year-old men that are having stroke because the blood pressure is not controlled. I had 42-year-old man who had stroke recently, right? Who was in the hospital. He would not take his medications. Kidneys and blood pressure, diabetes are all connected. So we need to make sure that we are, whatever way that you can find the strength to go in. If that doctor doesn't listen to you, or you feel like they're not partnering up with you, get another one.
Get another doctor.
I see a lot of Caucasian patients that'll come in and they will interview me and go, oh, I'm doing established care. What it means is you've got 30 minutes with me. You could ask me any question, as long as it's not a personal question.
Yeah.
But like, interview me.
Yeah.
So do the same thing. If other people are doing it, because they come in, they want to feel like they can feel comfortable with you. And if your doctor is not listening to you, then that's not the one for you. If they're not partnering up with you, that's not the one for you. If you're not getting your labs back, or you're not understanding your labs and they're not explaining it to you in a way that makes you feel comfortable, get someone else. A lot of us do not write in to complain. There's an amazing person who's Somali. He's a writer and journalist. He sends me an email recently and says, I was at a such and such clinic. This happened. And wallahi, what he sent me we've made such a big change in that organization because of that one email that he sent to me, right? He didn't go out and blast it on Twitter, but like he sent it to the right person that he thought could
make a change or figure it out.
And then I brought him into it and I said, tell me, how can we change it? Can you sit at the table with us? And he's famous and he's amazing. But like, I loved that he took the time to write 3-page letter.
I love that.
But that showed how much he cared. I respect him. I'll forever respect him because of that.
That's
we
amazing.
need to, you get a phone call after your visits, and we get bonuses. There's a lot of things that the doctor is going to improve on if they see their numbers going down. Please fill those out. Organizations will listen. Okay. So I want to ask this question. Can we talk about sexual health? I love that topic.
I know you do. I know you do.
I'm certified in that.
Yes, and I know we've talked off record about sexual health, but I'm really curious. Obviously, within our Somali community, we don't talk about sexual health.
You need to.
And I think, and it's all part of that, again, preventative care that we're talking about. Please tell me why we need to, and let's talk about just how we can dismantle this system of just this not, talking about something that's so important and affects our lives.
Yeah. So I see this a lot, right? A lot of Somali men, they want to talk to me about wanting to even get Viagra, right? There's no shame.
Yeah.
Well, do what you have to, I will give it to you happily, but we need to go through these questions. And I want to ask those questions. One, can I give you some foods? Because there are some foods like beets, right? You make smoothie, they're nasty, but like it helps like
It
get,
does the work,
it does
right?
some work,
Yeah.
right? In between, there are nuts that you can eat, like regular nuts. There are some that help. So like nutrition that you can work on. And then on top of getting a little help here and there. But like they'll come in and they'll talk about everything but what they wanted, right? But I have learned to understand now that someone is beating around the bush. So I'm like, "Sahib, wax ma kuu sheegaa," right?
Yeah.
So I just kind of like break it down. I'm like,
Yeah.
please tell me exactly what you want. Because he keeps talking about, nimankena, or like our guys, lately we drive a truck. He said, "Wax ka soo isdhexgalaan." I was like, what does that mean? Meaning like everything kind of, I was like,
Yeah.
way isdhexgalaan, that's what it means.
Mhm.
So like I have picked up on languages that another doctor may not be able to pick up
Yeah.
or may not be excited to talk about because they're just like, I don't want to make this person feel more uncomfortable. I love making my patients uncomfortable
Yeah.
because that's where we
Again,
grow.
you build trust.
Yeah,
Absolutely.
let's call it out. And then I give them the medication, or I go, okay, take your blood pressure medication. That's not what's doing this. If you do not take your blood pressure medication, or if you do not take care of your diabetes, waxaad dhibaatada hadda ku haysato,
It's
like
gonna get
whatever.
worse.
Oh,
That's gonna
gonna
release
get
your
worse.
problems.
Ha.
Yeah.
So we talk about how that's like, and then you'll see a lot more compliance in that, right? The new thing is, can I get testosterone shots or like steroids? And then we talk about the effect that it has.
And do you talk about telling them to go to the gym? Just like, can you go to the gym and work out
Everything
healthily?
but the gym.
Yeah.
No.
Oh God.
No, I'm just joking.
Yeah.
But wallahi, it's so, I love. And then women, right? They're more comfortable talking to me about sex.
Yeah.
Because
Yeah.
tell me, how many days a week are you having sex? Can you ask your husband or your significant other that you feel hot and ready, right? Wallahi, a lot of Somali women are like, "Marhaba," or like even like a lot of East African women, Hmong women, like they tend to like say, you don't ask the guy if he's ready, right? He comes to you. No, sister, that's not what it is.
Yeah.
I think I had to go get it, right?
I love that. Yeah.
But like, I think it shows that you're comfortable in your relationship. You're safe in your relationship. And I think those are some discussion that we don't talk about. If you go to my mom, right? She'll
Yeah.
tell you, "Gabadheeda gabar fiican," you know?
Yeah.
So we don't talk about it, but
I
we
mean, it's just
should.
like, that's how I feel like, when you grow up in a Somali household, obviously you have like 8, 9 siblings.
Yes.
And you're about to get married or whatever the case is, and you're not, they don't give you that. It's like it's like it's like it just, the babies just happen. And
How?
it's
What's
like
about that?
we need, and then
Prep
I
me.
feel like it affects our youth as well because
Yes.
they're curious.
Or we're having a lot of STIs that I'm sorry, but if we do not take care of gonorrhea, it has big consequences, right? Syphilis is out right now. There's an outbreak of syphilis. Qofka hadlay ma maqashay? No, because we don't talk about that.
Even, and not just within our community, but also HIV.
Oh, yes, even in our community.
Yes, I've
I mean,
been to HCMC and I
Yeah.
hear the
Yeah.
cases, and I'm like,
Yeah.
this is insane.
Or even another thing is there's a patient recently that was diagnosed with herpes, right? But herpes, we don't know where we got it from. But
Yeah.
her husband coming, he saw my chart, and it was a big problem, like to a point divorce us. But I'm like, "Sahib, wax ma kuu sheego, herpes kan qofkan inuu ku dhaca laga yaabo markay 2 sano jirtay," because back then our parents will allow anyone to kiss us, or it could be just.
It could be, there's a lot of germs in the air. Yeah.
So just having those conversations and saying this is not something
Educated them.
right?
Yeah.
But if we had those discussions or moms were not uncomfortable back in the day, I know when I went to 8th grade, 9th grade, my mom was able to sign me out of the health class. Please don't do that.
Don't do that. I
Let's
agree.
not. Yeah,
Don't do that.
let them learn. Either way, they're gonna learn. I'd rather they learn from a place they're safe. They're getting the right information, and wallahi, we will we are less likely to have sexually transmitted diseases, or we're going to have less likely for that child to get pregnant at the age 17, 19, 18. Just being honest.
Yeah,
So yeah,
100%, because you're educating them.
you're
They're not
educated
going to look answers elsewhere,
elsewhere,
making mistakes and all of
yeah,
those things.
yeah,
It's things that they will learn and be preventative about.
or or having even creating brave spaces where your kids can come and talk to you, right? When they feel uncomfortable, when they're being pressured. I'd rather my kid tells me, Hoyo, this is what's going on, than they go up to their friends who may not know the right answer.
Yeah.
It may hurt in the beginning, but you could ask any of my kids, they'll tell you, I'd rather you tell me the truth than you lie to me. Because if once you lie to me, there's no coming back.
Exactly.
That hurts more than anything that you did. So please, let's create open spaces where our kids are brave enough to tell you anything.
Yeah, not getting upset if your kid asks you a simple question or maybe makes a mistake and they don't feel comfortable coming to you.
Yes. Or even like bring them to a provider that will honor your wishes, but like also advocate for that child, right? Because I do this with vaccines also, where mom will say no, but I can clearly see the daughter's sons are wanting it, right? But at that time, I'm advocating for that child. So how I try to come up with different ways to get them what they need, or always finding time within to say, hey, I need 10 minutes with this kid. And then we talk about things that they would want to talk about, right? But that doesn't mean that they're being encouraged. It means it's already happening. So a lot of people will tell you, "Takhtarka sa aadin," because ciyaalka keligeeda qolka la gashaa waxay u sheegayso ma la aqaano, right? No, I'm not telling them anything like that. It's something that's already happening in their head. And we're giving them the space to talk about it. Yeah.
Oh my God, Munira, I wish I could clone you into 1,000,000 Muniras, because I just wish we had someone, because not only are you coming from a professional standpoint, of having that education, that doctorate, and you're working in these clinics, but you're also coming from someone who's a mother, who's a woman, who's a person of color. And I feel like you are an immigrant, exactly. And you are able to really understand all the dynamics of the challenges that we go through in this unperfect health system.
It is.
And this, again, like I said, like health terrifies me because of how dismantled it is. And it's interesting because, you mentioned in the beginning of the interview how you were treated unfairly as a staff. And in my mind, when I'm thinking about like being treated unfairly, I'm thinking about the patients being untreated. But I didn't even think about, wow, also doctors and nurses of color, the things that you guys go
respiratory
through.
Therapist. I came in. Yeah.
That's insane. And it's so broken. But I have hope because there's people like you.
There is a lot of amazing
And especially since you were able to like speak up. And I think it's important. That's a huge highlight of this episode, is like how important it is
to speak up,
to just speak up. And like things can
your
change.
voice matters. Wallahi, it changes a lot.
Yeah, absolutely. Because I'm sick and tired of these documentaries of this nurse killed 200 babies and this happened.
No one said anything.
Like this shouldn't be happening. And like falling under the rugs of a hospital or clinics.
Did you know at one of the healthcare organizations we brought was it the second year after George Floyd was lynched, when we brought his everything, like all the artwork. We did a walkthrough where patients, community members could come into the hospital and see a big poster. You know how many nurses quit, how many doctors took time off and not want to go into that healthcare organization? That tells you there's a lot of work that needs to be done there, because no one should not feel uncomfortable to walk into a healthcare institution just because
highlighting
the inequities that has happened, the injustice that has happened, right? And then I'm like, we work with these people, right? And then some will come to you, because I am a big fan of Minnesota Nice. So like people feel comfortable talking to me, but at the same time, there's a line, right?
There is, and there's that passive aggressiveness, and I do think that there are people who have character development. Maybe they were in a different system or raised, and then they can
Right.
open their eyes one day and like, oh, this is wrong. Like
This
I was
is
a
wrong.
shitty person
Yeah.
and I need to make
Inshallah.
changes, inshallah,
Yes.
hopefully. But that again, I keep saying this terrifies me because I'm just imagining of like all the people who come to the hospital and there's not just hospitals, it could be teachers at schools,
Definitely
lawyers,
teachers.
it could be it could just be anyone that you're trusting in your care and
Yeah.
they are discriminating you
Yeah.
or they are just
Yeah.
blatantly
Yeah.
racist, even if they're not
Yeah.
vocalizing it. They're showing up by their actions by neglecting your needs
Yeah.
and needs that you have every right,
Mhm.
to have service for.
Yeah, it shows in our just like our policymakers, right?
Yeah.
Right now, you see all the policy changes that have happened.
Hmm.
So all of those things are so scary because I don't know. One thing I love about America is like we can say anything that we like, and you
Yeah.
do not have to watch your speech, right?
Sort
Because
of. I don't know about
not
nowadays.
anymore. So that
Yeah.
right, that highlight, like last night, I went through my LinkedIn. I love LinkedIn. It's
Hmm.
like, oh my goodness, did I say something that could take my citizenship away?
Yeah. It's
Wallahi, for the
scary.
first time, I was like, I need to look because I do talk about vaccines. I do
Yeah.
talk about health equity. I'm like, did I say something that could get me out
They're going to
there?
be like, girl, you talking
Girl,
too much. You
you
got to
going back to
go.
Somalia?
Yeah.
مرة. I
Yeah.
love Somalia. I go back all the time. But like,
Yeah.
this
But
is
just
my
having your
home,
own right of like
Yeah.
being where your kids are and where you want to be.
Yes.
How do you, because you just
Scary.
have such like amazing energy and hope and faith. Like, how do you stay strong? Like, what keeps you continuing to fight for us?
First of all, I have like an amazing family.
Mashallah.
Wallahi, we all live around each other.
Hmm.
That helps a lot. That grounds me, right?
Yeah.
But at the same time, I hate someone who brings me problems.
Hmm.
I'm one of those people, like, if I bring a problem, girl, I've already thought about the solution. I already have my soldiers that I'm going to do it with, right?
Yeah.
So I love that collective environment where we could all do something about the problem
Yeah.
together. And that is what gets me going. It is partnering up with different people in looking at the problem, but like saying, hey, we can change this. And
Mhm.
that makes me really excited. That's
Yeah.
what gets me out of bed.
Yeah,
Yeah.
that's amazing. Before I ask you, the concluded question, is there anything else that I missed that you want to highlight and talk about?
One thing that if anyone can take away from this, I love diversifying our workforce. We were supposed to get a appropriation grants for our 84 students that want to go into healthcare. So we're trying to find partners and for that, or if you want to sponsor Motherhood Circle for another year. Last year we were sponsored by Children's Hospital, so we're looking for a new sponsor. Please reach out. Um, our email address and everything can be shared.
Yeah,
Yeah.
absolutely. We're going to share it on all our platforms. Okay, so one last thing, like any final thoughts and like any final advice? I know you dropped a lot of gems this episode, but what can you say right now to someone who is struggling to find a place in the healthcare system or struggling to get answers and they're going through any type of health disparity, mental
Mm.
health?
Mm.
What advice would you give them?
I would honestly say continue to fight for yourself, right? Go to places where you're seen. So, like, even if we are open, so if you came to the Motherhood Circle, whether you're a woman, whether you're black, white, anything, that's a place where we can find the resources for you if you liked, or going to a safe place where there is the emergency room and just saying, hey, I need help. I just do not want someone staying home when they need that resource, and that resource is out there. There are people that are excited to help. There are so many organizations that are doing the great work, and we can definitely get you connected. In general, I would say, if please make your voice heard. Every voice matters. Even if you just call in and say, today how my visit went, that's not how it should have went, right? I felt like I wasn't listened to, or I wasn't valued. So let them know.
Yeah.
If something went wrong, there was a medical error or anything happened, let them know, because
Mhm.
something comes from that.
Yeah.
And that's something that you made happen. That is a way for us to, one, show up for each other, and two, a way for us to hold the system that was not built for us accountable.
Absolutely. Thank you, Munira.
This was so fun.
We're gonna need you to come back because I still have like 100 million questions. Like I can make a series out of this. So inshallah, I would love to invite you back. You have a website
Mm-hmm.
that we'll share, and you have a physical clinic.
Clinic,
Where is
yes.
it located?
It is in the Phillips neighborhood. I just want to say a little bit about that neighborhood.
Absolutely. Let's
If you
talk
don't
about
mind.
it, please.
This is like South Minneapolis, right? This is 40% of the residents around that area are foreign born, and 1 in 3 of those families that live around that area are below the poverty line. And then the health literacy around that area is very low. So we really intentionally picked this clinic on 2015 Chicago Avenue in Minneapolis simply because of that.
Yeah.
That area matters a lot to me, and we wanted to start our first journey and for growing and learning from the community in that area. So I'm excited.
Thank you.
Yeah.
And I'm sure you're going to make, astronomical changes in that area, inshallah. So, we're looking forward to support you.
Thank you.
And I'm sure a lot of people will get in contact with you. I will personally. So thank you for joining, and we hope to see you next time.
Oh my God. Thank you for
Yes,
having me.
Thank you. And thank you guys for watching, and we'll see you in the next episode. Bye.